Hello, this is Professor Shauna Smith, and this video is on clinical judgment on the NCLEX. The National Council of State Boards of Nursing, the NCSBN, has revealed the nursing clinical judgment model and determined that the new and improved next generation NCLEX will include new item types to gauge candidates' clinical judgment and decision-making aptitude in nursing situations. So this will help nurses think critically when providing care and to make the right decisions. Learning clinical judgment is about protecting the public and achieving the best outcomes for clients, nurses, and institutions. This increased focus on evaluating student readiness for transition to practice creates a need to learn the significance of clinical judgment. What is clinical judgment? Clinical judgment is the ability of the nurse to think in action and reason as a situation changes over time by capturing and understanding the significance of clinical trajectory. Understand, and then apply clinical judgment. According to the National Council of State Boards of Nursing, the NCSBN, clinical judgment is the doing part of critical thinking and clinical decision making. It is the observed outcome of critical thinking and decision making. It is the iterative process that uses nursing knowledge to observe and assess presenting situations. And it does identify a prioritized client concern, and it generates evidence-based solutions to deliver safe client care. This is important to note because a lot of research points toward the need for more doing during the learning process in nursing education. The main goal of the NCLEX is to help identify whether nurses entering practice are safe and practice ready. With the NCSBN concerned with safety and practice readiness, there is this huge importance of assessing graduates with a tool which focuses more on clinical judgment. The NCSBN wants to ensure graduates possess the ability for high-level processing. The clinical judgment model offers a new approach to bedside decision-making, and clinical judgment is a process that uses nursing knowledge to observe and assess presenting situations, identify a prioritized client concern, and generate the best possible evidence-based solutions to deliver safe client care. Why learn clinical judgment skills? Today's practicing nurses are required to accurately assess, use evidence, and make sound clinical judgments in order to ensure the most effective patient outcomes. Possessing adequate clinical judgment is foundations to safe nursing practice. Clinical judgment is linked to almost half of all nursing tasks performed. Actually, 50% of nurses are involved in errors, and 65% of those errors are due to poor clinical decision-making skills. The NCSBN clinical judgment model describes the identification and analysis of cues as a preliminary skill that builds clinical judgment. And a correct clinical judgment is the end result of how a nurse thinks, and both critical thinking and clinical reasoning must be utilized by every nurse to make the safest decisions for client care. 4 components of clinical judgment. 1. Think in action and reason as the situation changes. Patients do not typically stay static over time, but they either improve or gradually or quickly deteriorate. Therefore, learners must be prepared to think on their feet and recognize the nursing priority when the status of patients change, and be skilled in early recognition and management if a change in status occurs. A problem must be anticipated, then recognized when it occurs before the nurse can intervene and do something about the problem. Anticipating and even expecting the most likely or worst possible complications for each client develops the skill of being proactive and not reactive in clinical practice. Number 2, identify relevant clinical data. Too much information in nursing education is a barrier to student learning and mastery of content. To be able to notice and identify what clinical data just collected is most relevant, students must first develop a deep understanding of the applied sciences that include pathophysiology, pharmacology, and fluid and electrolytes. This knowledge is then applied in the clinical setting when analyzing physical assessment findings, vital signs, and laboratory values for each patient that is cared for. Once clinical data are correctly identified as relevant, the next step of clinical reasoning is to trend this data to determine the clinical trajectory or trend that the patient data is suggesting. Number 3, understand the significance of clinical trends of the relevant data. So, identifying and trending the most important or relevant clinical data by comparing current data to previous readings and is an essential component of clinical reasoning and a hallmark of thinking like a nurse. To rescue a patient with a change in status, the nurse must be able to recognize subtle changes in the patient's condition over time. Rescue is facilitated when the nurse trends relevant clinical data and is intentionally assessing early manifestations of the most likely or worst possible complication. And number 4, make a clinical judgment to determine if an actual problem is present. So clinical judgment is the end result and hallmark of professional practice. Clinical judgment can be defined as the interpretation or conclusion about what a patient needs and or the decision to take action or no. Failure to take action can equal failure to rescue and result in an adverse outcome or even patient death. If a nurse in practice is unable to clinically reason, the results can be an incorrect clinical judgment. To consistently formulate safe and correct clinical judgments, the nurse must be able to use knowledge, integrate nursing process, think critically, and use clinical reasoning to make a correct clinical judgment. Though it is imperative that clinical judgment be correctly understood, that's simply not enough. Clinical judgment, like everything else in nursing education, must be able to be practiced so it can be applied to the bedside. So every learner must be able to use and apply clinical judgment to ensure safe, quality care that will result in improved patient outcomes before graduation. Failure to do so can be a matter of patient life or death. In this slide, we're going to go over the types of clinical judgment thinking skills. There are 4 types. We have basic level thinking skills. We have gathering data. We have providing nursing care. And we have evaluating responses. So clinical judgment is not an option, but a foundational part to nursing practice. To be prepared for clinical practice and think like a nurse, learners must understand and then incorporate clinical judgment into their practice. Every learner must have clinical judgment skills before they graduate and enter the nursing profession. Learning to think like a nurse is learning a clinical judgment model and framework to prepare you for the next generation NCLEX, but most importantly, to improve patient care. Each student needs to learn the thinking skills and strategies aligned to the NCSBN's clinical judgment measurement model that is being taught in this presentation to be able to provide the best and safest patient care. So we're going to go over each of these 4 clinical judgment thinking skills. In the next few slides, we're going to go over these individually. Basic level thinking skills. So learners need a solid knowledge base from which to draw information for answering questions requiring higher level thinking. Knowledge refers to information committed to memory as well as knowing how to find needed information. Learners also must be aware of all the resources available that can be used to find the information needed to solve problems and make decisions related to patient care. The skills in this category provide this foundation. So first we have identifying signs and symptoms. An ability to identify signs and symptoms of disease, side effects of drugs, and a host of other causes is based on knowledge of normal functioning. Higher order thinking skills, such as comparing and contrasting, are used to differentiate normal from abnormal. Secondly, we have recalling knowledge about diagnostic tests. So, laboratory and diagnostic tests provide a window into the patient's internal environment. These studies provide critical information necessary for an accurate assessment, the basis for the subsequent steps of the nursing process. Nurses must be aware of all aspects of diagnostic testing. This knowledge is necessary for properly scheduling tests, ensuring the most accurate results, and carrying out post-procedure care so no harm comes to the patient as a result of the testing. And last, understanding the physiology of body systems. So understanding the physiology of body systems serves as a foundation for performing an accurate and complete physical assessment. Knowing what is normal is key to detecting abnormalities. This knowledge is necessary for recognizing signs and symptoms of disease, diagnosing actual and potential problems, and evaluating the effect of nursing interventions. Gathering data. Each of the thinking skills listed in this category are commonly used when a nurse gathers data. First, we have assessing systematically and comprehensively. Assessing systematically and comprehensively is a clinical judgment strategy applied to all areas of nursing practice. Nurses use a systematic method such as a body systems or head-to-toe approach so no areas are forgotten. A systematic and comprehensive approach is also used when collecting data during a shift report. Most nurses use a specific format for gathering patient data to ensure that all important areas of information are noted. Next, we have checking accuracy and reliability. Nurses must make judgments about the accuracy and reliability of information. Decisions about what nursing actions to take are based on this information. Problems can develop or even harm can come to a patient if care is based on information that is not accurate and reliable. Next, we have clustering related information. So clustering related information refers to grouping together information with a common theme. This is the process used when formulating nursing diagnoses. Related signs and symptoms are clustered together to form the basis for a nursing diagnosis. Collaborating with coworkers. The clinical judgment needed to solve problems seldom happens when working alone. Many people can be involved. In soliciting information and suggestions from others, new perspectives on a problem are realized. Various approaches and solutions may be suggested. Present-day healthcare is a complex environment requiring the input and cooperation of many members working as a team. Team members engage in a clinical judgment process when they examine delivery of care, noting compliance with standard of care and adherence to accepted protocols. This team approach, with all members collaborating and working together, strengthens patient care and fosters positive outcomes. Next, we have determining the importance of the information. So nurses have a vast amount of information to sort through for every patient. This information may change often throughout the course of a day. Therefore, nurses must be able to determine the importance of information, act on that which is important, and disregard that which is not. Next, we have distinguishing relevant from irrelevant information. So the thinking skill of distinguishing relevant from irrelevant information refers to the nurse deciding which information is pertinent or connects with the matter at hand. All information about a patient may be important for the patient's overall care, but the nurse must sort out which information is relevant to a particular problem or situation currently under consideration. Next, we have gathering complete and accurate data and acting on that data. Gathering complete and accurate data is fundamental to critical thinking. Data is collected from all sources available to the nurse. The data is then used as the basis for solving problems and making decisions. So it is important that data collection is complete and accurate. Judging how much ambiguity is acceptable. Ambiguous refers to a situation that is unclear, uncertain, or vague. Ambiguity occurs when factors relating to a situation make it somewhat unclear or gray rather than black and white. Many situations appear similar on the surface, but actually differ when all factors are carefully considered. Each individual patient situation must be considered before making a decision about that particular patient. That is, all information is considered within the context of that particular patient situation. Recognizing inconsistencies. So the beginning point of the nursing process is assessment. Throughout the assessment, both subjective and objective data are collected. In reviewing all this data, nurses are consistent of any inconsistencies that may indicate additional problems that may not be readily apparent. And using diagnostic reasoning. The word reasoning refers to using clinical judgment to solve problems and make decisions. Diagnostic reasoning applies this type of thinking to clinical practice. Specifically, it refers to the formulation of nursing diagnoses about a patient's health status. Diagnostic reasoning is a complex process that takes into account many factors about the patient, such as current health status, family history, poor illnesses, and a host of other factors. When using diagnostic reasoning, it is always important to consider how the patient is coping with the situation or problem. Although helpful with the diagnostic process, assessing the patient's coping is often an overlooked aspect of data collection. The next type of clinical judgment thinking skills is providing nursing care, and each one of these thinking skills is commonly used when nurses provide care to their patients. Applying the nursing process to develop a treatment plan. The nursing process is a framework for providing safe, effective, and humanistic nursing care. This process is applied systematically by all nurses and serves as the basis for all the nursing actions. Consider the nurse's response to a patient's report of pain. The nurse immediately will assess all characteristics of the pain, formulate a goal and outcome criteria, develop a plan for controlling the pain, implement the plan, and then follow up with the patient to evaluate the effectiveness of the interventions. And all this happens within a matter of minutes. It is automatic and second nature to expert nurses. Next, communicating effectively. Communicating effectively is a highly complex process. Many factors influence communication. Examples of these factors include environment, values, personal space, attitudes, and even time. The nurse must be aware of these and other factors and not let them block effective communication. It is difficult to carry out effective critical thinking when communication is breaking down. Predicting and managing potential complications. Predicting and managing potential complications requires clinical judgment. Nurses must look at the big picture to predict potential complications that may exist for individual patients. The starting point is to know common complications related to a patient's condition, then consider individual differences that may point to additional concerns specific for that patient. Next, resolving conflicts. Conflict cannot be avoided. Conflict happens on a daily basis. Nurses are often in a rapid-paced climate full of urgency and serious consequences if errors are made. In this kind of environment, conflict is inevitable. Nurses in all areas of patient care must be able to maintain calm, avoid conflict, and if conflict should occur, handle it in a constructive manner, and these characteristics serve to promote an atmosphere that is optimal for critical thinking to take place. Resolving ethical dilemmas. Because ethical dilemmas are typically extremely complex issues, they require professionals to use critical thinking skills. A code of ethics provides a point of reference for nurses to use when faced with ethical dilemmas. The American Nurses Association, the International Council of Nurses, and the Canadian Nurses Association have all adopted a code of ethics. Nurses can use these to help guide their thinking processes when faced with an ethical dilemma. Setting priorities. Setting priorities or prioritizing is a thinking skill constantly used by nurses in all patient care environments. Prioritizing can be a simple task or a complex task that involves comparing and contrasting data and sorting relevant from irrelevant information. Nurses prioritize when caring for a group of patients and deciding which patients to see first and which patients could wait. They also use prioritizing when caring for a specific patient to determine which assessments and interventions are most important and must be carried out first. Delegating. When delegating care, nurses engage in many critical thinking skills and strategies. According to the National Council of State Boards of Nursing, delegating refers to a process for a nurse to direct another person to perform nursing tasks and activities. Delegating requires nurses to engage in assessing, planning, assigning, supervising, and evaluating. Each of these roles requires a high degree of clinical judgment and decision-making. When engaged in delegation activities, nurses are accountable that the delegation process is accurately and responsibly carried out in all patient care situations. Teaching others. In all aspects of life, teaching is empowering. Nurses empower patients through teaching. Teaching can occur informally anytime a nurse interacts with a patient. Teaching is also formalized through the written plan of care. One example is discharge teaching, which typically addresses specific areas such as medications, diet, activity restrictions, and follow-up visits. Another example of formalized teaching is diabetic teaching, which often involves written guidelines with a checklist to ensure all areas are covered. Clinical judgment skills are used in teaching. Nurses consider all factors, looking at the big picture in order to individualize the teaching plan. For example, discharge teaching has a different focus if the patient is going home alone, discharged home with a caregiver, or transferred to an extended care facility. The last type of clinical judgment thinking skills is evaluating responses. Evaluating and correcting thinking. So, after using clinical judgment to resolve a problem, make a decision, or plan patient care, it is important to evaluate the thinking that occurred. So, evaluating thinking means reflecting on what just happened, how the situation was handled, and what lessons can be learned for use in similar situations in the future. This type of self evaluation promotes professional development, enhances self esteem, and fosters insight into one's own thinking. Thinking about one's thinking is part of the total critical thinking process. The following questions may be used to evaluate your thinking. What thinking skills were used, and were they effective? Were the outcomes what was expected? If not, were the outcomes acceptable or perhaps better than expected? If the outcomes were not acceptable, what might be done differently in the future? And how did the thinking impact all the people affected, such as the patient, significant others, and other healthcare providers? And was the impact positive or negative? Evaluating the data. Evaluating data is the basis for several steps of the nursing process. Data collection is part of the assessment step. Accurate and complete data collection provides a database on which to formulate diagnoses and interventions. Data collection is carried out again during the evaluation step to determine if the interventions were effective. Because data collection is such an important part of the nursing process, it is necessary for nurses to evaluate the data for accuracy. Many times, nurses must question the data collected, collect additional data, or take further steps to verify accuracy. Inadequate data collection can have a detrimental effect on patient outcomes. And supporting conclusions with evidence. Nurses often have intuition feelings about what is happening with patients. Intuition can be quite helpful as a starting point, but should not be the sole means for identifying problems. It is important for nurses to collect data that support suspected problems and formulate nursing diagnoses based on evidence rather than jumping to conclusions and focusing in the wrong direction. Applying the steps of the nursing process helps ensure a systematic, scientific approach to data collection and analysis. Next, we have Tanner's model of clinical judgment. Tanner's model of clinical judgment provides a background of information that is needed to better understand the essence of the clinical judgment model that is being used by the NCSBN on the next generation NCLEX. First, we have noticing. This emphasizes the nurse's expectations of the current clinical situation. Though this can be part of nursing assessment, it is really much more. It emphasizes the nurse's expectations of current clinical situation. If the patient is presenting in a way that is expected or unexpected, a decision can be made based on his or her knowledge that is used and applied from the textbook as well as from prior clinical experience. Can the nurse identify what the most relevant clinical data is and why? Next, we have interpreting. What does this data mean and what is its significance? Once the essence of the current clinical situation is grasped and relevant clinical data is identified, this data must now be interpreted. What does this data mean and what is its significance? Unless a nurse has a deep understanding of the applied sciences, especially pathophysiology, the ability to correctly interpret will be impacted. Responding. Based on the correct interpretation, does the nurse need to act or rescue, or is further monitoring warranted? And reflecting. Two aspects of reflection are needed by the nurse to practically strengthen and develop clinical judgment. We have reflection in action and reflection on action. Reflection in action is the ability of the nurse to read the patient and how they are responding to current nursing interventions and adjust what is being done based on the patient's response. Every student in the course of clinical will make a clinical judgment based on data collected. To deepen your learning and reflect on your decision making, ask yourself, what can I learn from this? What, if anything, would I do differently? And how can I use this knowledge in future patients I will care for? Reflection on action is required when a more thorough level of reflection is needed by the nurse because an error or incorrect judgment was made in the course of clinical. Students, as well as all nurses, are human and will make mistakes. It is only a matter of when. Use this as an opportunity to learn from the error into judgment and determining what can be learned from what we just experienced and how that experience will contribute to ongoing clinical knowledge development that can be used in the future. It is important to note that based on Tanner's model, the nurse must be able to use knowledge in order to notice as well as interpret the clinical data that is being collected. Next, we have the 6 steps of the NCSBN clinical judgment model. The clinical judgment model has multiple layers of clinical decision making that include processing knowledge through the lens of generalist experience and practice, patient observation, and knowledge of the topic. These are the 6 specific processes to make a correct clinical judgment. Step 1. Recognize cues. Identify and recognize relevant clinical data using different sources available to the nurse. This includes both rapid and priority cues that identify an urgent concern and supporting cues that, when clustered with the rapid cue, support the potential problem or priority. Recognize relevant clinical data from the presenting scenario, medical history, vital signs, nursing assessment, and laboratory values, and then extract important clinical data that is most concerning to the nurse. Step 2, analyze cues. Be able to interpret cues from existing knowledge base. This is the essence of critical thinking or clinical judgment. We act on what we know. Organize and recognize patterns of clinical data and tie them to the patient's clinical presentation and primary concern. This requires generating multiple hypotheses or reasons for clinical cues that are collected. To analyze or interpret clinical data, you need to use and apply knowledge to the bedside where it matters most. Step 3, prioritize hypotheses. Here is where you need to narrow it down to the most likely or most pressing problem. Of the multiple possibilities identified by recognizing relevant clinical data, which hypothesis is the priority and the most pressing or concerning problem? Step 4, generate solutions. Expected outcomes need to be identified using the priority hypothesis to establish a plan of care with nursing interventions. The need to collect additional clinical data needs to be considered. Critical thinking that is reflected by understanding essential knowledge is a key component in this step. And step 5, take action. Now, here it is time to take action and implement the solution that addresses the top nursing priorities. Here you need to respond using critical thinking by acting on what you know. Determine the most appropriate nursing interventions. Implement nursing interventions to address the hypothesis with the highest priority. And last, step 6, evaluate outcomes. This is the final step of the nursing process. The nurse compares the observed outcomes to what was expected. Were the interventions identified in step 5 effective? You need to compare the outcomes against what was expected based on disease progression or the patient's response. So determine if additional clinical decisions are needed. Here are 7 questions to develop clinical judgment. So by taking each step and capturing its essence with a question and using this in the clinical setting with patient care, you can practice the process to make a correct clinical decision. So the 6 steps that we just went over in the clinical judgment model of the NCSBN is what we're going to discuss here. So the first question, what data are relevant and must be interpreted as clinically significant by the nurse? That's the NCSBN step 1, recognizing cues. Number 2, question, interpreting relevant clinical data, identify the most likely problem. Is additional data needed to confirm the significance of clinical cues collected so far? That is the NCSBN step 2. The analyzing the cues. And then number 3, rank the most likely problems by urgency. That's the NCSBN step 3, prioritize the hypotheses. And number 4, which problem is most likely present? What problem is most concerning and why? That is also the NCSBN step 3, the prioritize the hypotheses. And then number 5, based on the most pressing problem, what are the priority actions? This is the NCSBN step 4, generate solutions, and step 5, take action. Number 6, evaluate the patient's response. Recognizing relevant clinical data, has the patient status improved, declined, or remained unchanged? This is the NCSBN step 6, evaluate outcomes. And 7, if the patient status has not improved, what problem may be present? What additional interventions need to be considered? This is the NCSBN step 6 as well, evaluating outcomes. So let's practice using the clinical judgment model. So this is an example of practicing the 6 steps of the NCSBN clinical judgment model in a real-life case scenario. So your example that I'm giving you today is a client returns from radiology and has labored breathing. So use the steps to the clinical judgment model. 1, recognize and analyze cues. So the client has labored breathing. There could be a problem, so I need to think about this. Next, prioritizing hypothesis. Could the client be experiencing an oxygenation issue or a circulatory complication? Was this too much activity for the client? Could the client be in pain? Those are some questions that you might ask yourself when you're going through that step. The next step, generating solutions. Since my priority concern is oxygenation, I need first to check a pulse oximetry reading. The next step, taking action. The pulse oximetry reads 89%. I will raise the head of the bed, encourage deep breaths, and apply oxygen at 2 liters if still needed. And the last step is evaluating outcomes. The oxygen level has increased to 94%. After the oxygen is applied, I will now oscillate the lungs and determine if there are additional cues needed. Now that we've went over the clinical judgment model and how to apply that in our nursing practice, let's wrap this video up with tips for dealing with test anxiety. So we need to be extremely aware of ourselves when we take a test. When you notice any of the test anxiety symptoms, we're going to stop and take steps to deal with it. Remind yourself that the pressure you're feeling is not real, and remind yourself how hard you studied for this test. So we've learned all of this information so that we can be successful on the NCLEX and that we can be a safe, efficient, practicing nurse. So, some things that we need to deal with: study better and prepare. Smaller, more manageable chunks. So, spread it out and don't cram in your studying. Study in small segments for about 1 hour and then take a 15-minute break. Do something physical on your breaks, maybe yoga or take a bike ride or walk. And be finished early and don't stay up late studying. If you're off from work, maybe you get 5 or 6 hours of studying in that day. But days that you do work, maybe you can only get 2 to 3 hours in. Nothing can increase your anxiety more than not adequately preparing for a test. So put the time into your education that it deserves. Do the hard work up front and don't wait until right before the test to decide you're going to hit the books. So stay engaged with your studies at all times. Manage your time better. Eliminate your distractions. So don't be checking Facebook or social media or watching TV or playing video games or even hopefully, or if you can, not have your children around while you're studying. So you need to possibly cut out all non-essential activities such as maybe social outings to make studying a priority. And don't miss your scheduled study sessions that you have for yourself. Hold yourself accountable to make those study sessions. Test yourself. Do as many practice questions as you can find. For every ball you hit on the golf course, hit 100 on the range to practice. So treat every practice test as the real thing. Put pressure on yourself with every practice question and every practice test. Get accustomed to that pressure. Time yourself and you will realize that you may be going through the questions way too fast and have room to slow down and read the question more closely and actually think about them. Get a pre-test routine going on. So the day and the night before the morning of the test, relax. Do not stay up late studying. Stop by 8 o'clock and go to bed. Stretch your arms, your neck, your back, and do your deep breathing exercises of 10 slow, deep breaths in through the nose and out through the mouth. Positive thinking. Talk to yourself and tell yourself how much you have prepared for this test. Tell yourself you have studied and prepared for this test and you will do great. Tell yourself at least 3 things to help refocus or reduce your anxiety. Like, I can do this. I've got this. And I studied and I am ready for this test. Think positive and talk positive to yourself. Eat. Make sure that you're eating the day of the test and not junk food, even if all you can do is nibble on something. Maybe just nibble on something that's healthy. Your brain can't work if it is inadequately fueled. Eat a well-balanced breakfast, definitely the morning of the test. Rest. Make sure you are well rested the day of the test. Don't stay up all night cramming for the exam. Get at least 8 hours of sleep the night before. Relax, just like you practiced. Keeping things in perspective is huge. This test is not the end of the world. It's just a test, so keep it real. Check in with your body. Do you know that you're stressed or you're having anxiety at the moment? Is your forehead furrowed? Is your neck tight? Are your shoulders all hunched up? Are your hands fisted up? If you feel anxiety coming on, then stop and do not go to the next question. You want to take your eyes off the screen and take a minute to stretch. Take a minute to breathe and take deep breaths, as well as the positive talking to yourself to work through the anxiety before you continue with the test. This is where all the practice tests that you've done come into play. If you put pressure on yourself for each practice test, this won't feel any different. Slow and steady wins the race, so don't see how fast that you can get through the test. Instead, take your time, read each word, look for the clues, and relax. Stretch. Take time to stretch during the exam. It feels good and it really does help, and it helps you with your blood flow and your energy level. Focus. Focus on the task at hand. Put everything else out of your mind and focus on the test. Read the questions carefully and use your critical thinking skills to answer them. Don't worry about the next question or how much longer you have to finish, focus on the task at hand. Finally, once you have chosen your answer, stand on it. Once you have answered a question, forget about it and move on to the next. Do not second guess yourself and do not change your answer. So here's an exercise that you can do for yourself. You want to take 10 slow, deep breaths in through the nose and out through the mouth. You want to stretch and relax and answer these questions. Describe how you feel after doing deep breathing and stretching. How do you think the deep breathing and stretching will help you during the test? List 3 things that you can say to yourself to help refocus or reduce your anxiety during a test. Read your 3 things and ask yourself, what effect can they have on my level of anxiety? If you did the deep breathing activities, the stretching, and the positive thinking for a few minutes before your next test, what effect do you think it would have on your test? I bet it will help, so give it a try. If you have any questions or concerns, please don't hesitate to connect with any of us NCLEX coaches here at Nightingale, myself, Professor Shauna Smith, or Professor Tom Hazel.